I have to really take charge of my body rather than listening to, let's say, health practitioners who would say, you need to strengthen this muscle.
Hello, and thank you for coming back to join us here on Mind Body Medicine for Self-Healers. I'm your host, Sarah Dawkins, and my guest today is Bonnie Ryckova, who is a chronic joint and back pain specialist, working with people whose pain keeps returning despite physical therapy and exercise. Bonnie's work focuses on understanding how the body has adapted over time and where the load is no longer shared evenly. Her background includes biomechanics, clinical Pilates, and postural therapy, alongside lived experience of chronic pain, hypermobility, and injury recovery. And this informs the way that she works with her clients: structured, body-led, realistic, and prioritizing clarity before action. So welcome, Bonnie.
Thank you so much for having me, Sarah, on your brilliant podcast. I listened to some episodes and they are all so good. So I'm very privileged to be here.
Thank you so much for your kind words, Bonnie. So from your bio, we've learned that you help other people with pain, but you also yourself have suffered pain. Could you walk us through how that started and what that looked like for you?
Yes, absolutely. So when I look back, it actually started very early in my childhood when I had simple ankle sprain. But because I sprained my ankle several times in the same day, where I no longer could walk without twisting, spraining my ankle again, so I had it in a plaster, in a cast for 6 weeks. And that was my first experience with injury, recovery, and then what happens after. Obviously, I was very young. I was 7 years old, so I didn't know actually what is going on. I just kept going with my life as a child, doing all the outdoor activities which I loved. But my doctor wasn't impressed when I came back after 6 weeks because the plaster was very cracked. So he could really see that I was doing whatever I could do to carry on with my life. But I remember it like today. And we don't realize how much even simple injury, like a sprained ankle, can affect our body. And it's actually a trauma which stays with you. And I remember it like today when they cut the plaster, when I saw my leg and I didn't feel connection to my leg. It looked very pale, it looked very thin, it looked very weak, it didn't look like my leg. And that was my first experience with actually feeling dissociation of one part of my body. It didn't feel like something which belongs to me. But obviously as a child, you just don't really pay attention. You just go, you just do what you love doing on a daily basis. But when I think back, that was that first point where it all started.
I'm sure, and at 7, obviously you've no experience of pain and plaster casts and rehabilitation. So did the doctor offer you any rehabilitation, or what happened after he took the plaster cast off?
So, and this is the thing, nothing happened. You just go, the ankle is healed. It's supposed to be healed, I would say, obviously, because we always put a time frame on healing in modern medicine, in Western medicine. So 6 weeks, this is what the rules are saying, and you should be fine in 6 weeks. In theory, yes, I could use my foot, I could use my ankle, I could do the other stuff. But what is happening inside no one really sees, and we usually don't feel it until it starts limiting us in life. So what happened? I didn't get any rehabilitation. I wasn't offered anything. So nothing really happened. I kept going. But I had another injury when I was around 10 years old, where I was hit by a wheel which came off a truck, of a lorry. I was walking from school home, and suddenly I felt impact, and I fell on my knee, right knee. Before it was right ankle sprain, now right knee, which I hit. And I was taken to hospital. I had an X-ray of the knee. There's nothing wrong. Everything is fine. Nothing is broken. But the next day, and I was aged 10, the next day I woke up and I literally couldn't move. Because of the impact where I was hit, more likely forced down hit to the pelvis, more likely I was hit and rotated from what my mom was saying and from what I remember from the fall, because I was on a bridge. And from what I remember as a child from that fall is, I just remember as if I'm falling in water. This is the whole memory I have. The memory is impact, I'm falling in water. And from what my mom told me later was that I was basically probably kind of rotated and forced on the fence of the bridge. So I saw water beneath me because I was looking down and as I was falling. So I guess the impact was really on the right side of my pelvis, and I was rotated with the impact falling down on my right knee. So the next day, my body felt like, yeah, everything was aching. My whole body was aching. Every single muscle. So I was just lying down, resting, and it did go away within 3 days. So again, there was nothing done. You don't need anything, nothing is broken. You just carry on with life. But I started to have issues later. As a child, we want to explore things. So I was given a bicycle and I wanted to cycle. But after just 3 kilometers, which is about 5 miles, my knee got swollen really badly. So I couldn't cycle. Then I started to have aches, pains, kind of sharp pain in my ankle, which I sprained before. And that was years after, that was about 4 or 5 years after, where the aches, pains, discomfort, and kind of the symptoms started to reveal itself because I've been using my body. I've been loading my joints. I just use my body as everyone else would use in childhood or in any age. So I realized later on, when I think back, that it's the demands we put on our body which will trigger certain symptoms. And the demands could be physical, but also emotional. Because I didn't really do any talking therapy, no one really talked to me about what happened so I can process the injury and everything else what happened. No one really talked to me how I felt when I went to a doctor. No one talked to me how I felt when the plaster was taken out, how I felt on my leg, and so on. So we don't really process the trauma, whatever trauma it is. And we are not offered really any sort of help, which would mean letting go of the trauma, processing it emotionally, but also obviously physical healing. So we know or learn how to use body, how to deal with, for example, after injury, what needs to be done to keep the joint functional for longer and stronger. We don't learn these things, unfortunately, in life or in school until something happens.
Thank you. So from what the injuries that you've had and the experiences and what you've learned, how did you then use that information to go back into your body and heal the damage done from those childhood injuries?
Well, that was a very long process because I became economist, so I studied economics, so I had no basically education in anything related to body, no matter if it's sport or something else. So I kept going with my life, and I had another injury. It's very unfortunate. It wasn't like that I would injure myself because I did something wrong. It just happened. And then I think the turning point for me was when I was much later. I was in my 30s, and I decided to leave my office job, and I decided, and this is something which I think came from my intuition because I can't explain it. I really can't explain it. I left my office job and I didn't have anything else. So I was looking for another office job. Something better, something which I would connect more, something which I would feel like, oh yes, this is what I want to do. And I couldn't find, and it was really a tough couple of months. And my intuition was saying, maybe you should explore something different. Who says you have to carry on with what you studied? And I had this crazy idea that I want to become a Pilates teacher. I didn't have any experience of Pilates except going to a few classes, but I loved it. It felt good in my body. I absolutely loved it. I didn't realize it was also the teacher who was really good. But I loved the flow of the movement. So I decided that I will become Pilates teacher. And I didn't have any education. And in that time, it was 2009. It wasn't that easy to become Pilates teacher. Now you can become Pilates teacher in 2 days. It wasn't like that before. I had to study for 2 years. And I felt, okay, I can't study for 2 years. I need to earn some money, so I can't just study. So what I decided to do, I decided to become a personal trainer. And while I'm doing personal training and I am in a fitness industry, I'll be studying Pilates. And this is what I did. As crazy as it sounds, from economist becoming personal trainer with no education and not really being a sporty person. But I can explain this as intuition leading me into, let's say, health and fitness industry. And I don't regret the journey, even though it was an easy peasy and rosy pathway for me. But I experienced how we look at fitness from the perspective of fitness, going to the gym, personal training. I experienced then what it takes, or how does it feel in a body doing Pilates, because it's very often suggested by health practitioners if someone has any joint and back pain issues. They say go to Pilates, but they don't say anything else. And then when I had another injury, I was already working as a personal trainer and Pilates teacher. I was hit by a car when I was cycling to teach group Pilates class. And basically, because I was hit by a car, I was taken to hospital. Again, nothing is wrong, nothing is broken, you are okay. Things were not okay at all. And that was the point where things started to really not feeling good in my body, in my joints, in my back. And everything from that point was just exploding in my body, I would say, in terms of more pain, intensity, everything. But I was offered a psychiatrist. I was offered, let's say, I would call it healing, which was processing the trauma. And this was the first time when I experienced how does it feel actually to process the trauma. I resisted so badly. I hated the therapist at the beginning. because it was so uncomfortable. I felt I don't need therapy. I am fine. I don't need to process the information. I was resisting so much, but the therapist was so good, obviously very experienced, and I actually managed to process the trauma and feeling, looking things completely different way from what I've been learning, and I was really looking the body physically because that's the pathway I choose. I became personal trainer, Pilates teacher. Everything is physical. You basically exercise, you strengthen your body, and so on. So this gave me completely different perspective on healing injury because it's a trauma. It's something which we need to process emotionally as well. And that set me on completely different journey, different trajectory. And yeah, I think things happen for a reason, I guess.
Yes, and I'm a big believer in that. I see that played out in my life as well. Things do happen for a reason. But at the time, it doesn't seem so. It seems so unfair, so unjust, so painful. But when we see the blessing in what we've been through, it's changed your life trajectory. It's changed my life trajectory. So there was a blessing and a lesson in what we've been through, but it's often after we've been through it and we're coming out the other side that we see that. So I love that the psychiatrist was helping you to uncover the emotional side of trauma because, as you rightly say, it often gets missed so often and we're just led down that physical path. So you've had all these injuries, all these traumas, and now you're processing the trauma. What happened in your body as a result of doing that emotional work?
My body calmed down because after the injury, obviously being hit on a bicycle, I didn't want to get on a bicycle. And when I tried, my heart was just racing, pounding. When I saw a car, even though the car was on a road, but it felt the car is close to me, my heart was just starting to really race and it wasn't a good feeling. So after I was able to process, my nervous system basically calmed down and I was able to get back on a bike without being scared. So that was the first feeling I had. But then I realized that it takes lots to do with our nervous system when it comes to injury, when it comes to pain, when it comes to healing. And that's, again, I had really great kind of lessons, I would say. And obviously we learn from the lessons. Because when I became a personal trainer, I was doing Pilates, but I got into the hustle of fitness. And in that time, I knew it didn't feel good to me. And I was rejecting the competitive environment. But then I was the one which is not really following the rules, and I was the one who is doing things differently. But I was attracting certain group of clients, which was good as well. I was attracting those people who were more vulnerable. They didn't want the fitness in terms of push, sweat, do things hard. They wanted to understand. They wanted to take things slowly. They wanted to progress and build up. And this is my belief now. So I started actually to, I would say, change the way how I think about fitness. That was the first thing. Change the way how I think about you have to exercise in order to get stronger. Because unfortunately, the exercise didn't get me stronger, didn't feel actually good in my body because my body was struggling. But I didn't realize, obviously, in that time, now I know, that my body adapted over the time and started to compensate. So what may feel good to your body maybe 10 years ago, 20 years ago, may not work now because things change, body adapted. And there are layers and layers of compensation which we actually develop over the decades. Since the trauma, since the injury, or since the thing happened, whatever it is in our body, we layer and layer the compensations because we are putting demands on our body. It could be traveling, it could be changing a career, changing the diet, it could be all sorts of things which we do in life to live our life. So it's these little things, layers, adaptations. And I realized in one point that I have to go completely back to the basics of the basics. I have to really take charge of my body rather than listening to, let's say, health practitioners who would say, you need to strengthen this muscle because this muscle is weak in your body. Yes, it was true. Certain muscles were weak in my body because of the injuries. However, my body was rejecting doing things the way, following the rules we unfortunately usually get because this is the textbook. You do this, and then you do this, you do this, and then you are healed. And that textbook approach of physiotherapy and exercise didn't work for me at all. And I tried clinical Pilates when I was training. I thought, okay, clinical Pilates will help me. So I trained as clinical Pilates teacher. I went to physio-led classes to get stronger. My body couldn't cope even 5 minutes. I was in so much pain, I had to leave. Couldn't do it. It was very frustrating, and in that time I didn't understand why. They say this helps, and I am doing exactly what I was recommended to do, and it's not working. So it got to the point where I remember it like today. I lie down on the floor and kept my knees bent like we do in Pilates. And I wanted to do certain movements, but I couldn't. It was so painful. And I didn't know that time what I was doing, but now I know that I was regulating my nervous system to bring me from the fight and flight, which I was constantly in my life, which I didn't realize because of the injuries. My body felt all the time threatened. So I was like on a pins and needles. I was always busy with something in my life. I was always like this and that without realizing that my nervous system is really in that flight and fight mode. And when I got into fitness industry, it was even more because you have to work hard. You have to be on a gym floor. You hardly have any breaks. You don't eat much. So it was just adding. It was just adding to the plate, which was already full. So I started actually regulating my nervous system. And then I started to listen to my body. Just lead me. Just tell me. Just I will follow your guidance. What I need to do to get the relief, to be able to move the way I know I can move. Don't guard, don't hold back, just let go. It wasn't easy. It didn't happen in one session, 2 sessions. It was actually a years. But also I had to realize that I'm stuck in patterns of flare-ups. And when I realized the flare-ups are coming in certain period of time, it was coming very regularly, twice a year in February and November. I started to realize that actually my body developed this pattern. It gets much better over summer. I'm more relaxed also over summer. And when it gets to the busy period of time, which is in fitness, it's January until March. That's why I have the flare up in February. I had to recognize my patterns. And then in November, it gets busy after holidays. So again, it was another pattern which I really had to recognize so I can really work with my body's adaptations and the patterns and nervous system regulation so I don't get into bad flare-ups. So my flare-ups started to get actually not that intense, not that they didn't take that long. Some flare-ups could take even 3 months. It was too long. So I was able to reduce the amount, the intensity, and the periods of flare-ups. So what I didn't realize, I'm breaking the patterns. So things started to change from that point, realizing I need to regulate nervous system and I need to recognize my patterns and start breaking those patterns. So this was the start of these two things which really, really helped me. So I don't get into self-pity because it's so easy, especially after my hypermobility diagnosis. For about 2-3 months, I went into the victimhood of I got a diagnosis, I'm screwed, this is it, nothing is going to help me, this is permanent, and so on. And that is not helpful at all.
No, it's not, as you say. And actually, I would imagine as you've started to regulate your nervous system and then getting that diagnosis of hypermobility, it would actually re-trigger your nervous system again and undo some of the work that you've done because you've now been given that extra diagnosis on top of what you're already healing. So could you just walk us through some of the things that you tried that worked for you with regards to regulating your nervous system?
Yes. So I think it might be slightly different for everyone. We need to get to know our body where we feel safe and as relaxed as we can be. And this wasn't easy for me at all. I tried reflexology and I realized it's not as much about reflexology rather than the person who is doing it, because I tried different practitioners and some I just couldn't relax, and I was actually the opposite. My nervous system did the opposite from what it's supposed to happen, and I didn't realize in that time the person was actually in a fight and flight mode as well. So my nervous system responded to the nervous system of the practitioner. It was very interesting to observe. So I did try reflexology, feet reflexology, and I found a practitioner who helped me at the beginning, in the very, very early stages where I didn't understand what is going on. But I felt I need to do something to relax. And like as many people do, and I did it as well, I was searching for the answers outside. So I was looking for practitioners. And I did find great practitioners, and it did help me, which was very important. It gave me actually the relief I needed in that time. So it's nothing wrong to find and to search for external help, but it will come to the point where we need to take the ownership of we need to start doing things on our own as well. So I did find a reflexologist. I had some couple of sessions, not really many. I found a myofascia released therapist, brilliant. It helped me so much. And I actually did it for 2 years until I got pregnant, where I couldn't have the sessions because it can trigger, obviously, labor. So that helped a lot, and I learned a lot from the process. I actually learned that I don't have to do the strengthening exercise. I actually need something more gentle, something which goes deep into nervous system and into fascia. So I learned other stuff. But then what I did myself was finding comfortable position for me to be able to switch off and relax. For me, it's lying down on the floor, and I guess it comes from Pilates because I'm very comfortable teaching network Pilates. So lying down, and what we usually feel when we lie down, even if we go to sleep, we feel things. We start feeling points of tension, we start feeling discomfort because we lie down, and because of we lie down and we go to sleep, our body knows you're trying to rest and relax. So what I did, even without knowing what I'm doing, but it worked. I just simply, during the day, whenever I could, I lied down on the floor. I kept my knees bent because it was more comfortable for my back pain and hip. And I started to simply relax and breathe. Again, I didn't know that I'm breathing to regulate my nervous system, but it worked. Now I know, and now I have even better system, obviously, better ways of breathing, and it works for clients. So lying down, getting comfortable, not getting distracted by what we feel, but being curious of what we feel. So I was curious about, okay, this feels not good, it feels good. I started to slow down, obviously, the breathing, regulating my nervous system, and letting my body to move as my body wanted to move. It could be rocking legs, it could be moving pelvis, lying down on your back. It could be any movement your body will tell you, do this, do that, don't do this, do that. Exploring your own body and also learning how to listen to the guidance of your own body, even if it doesn't make sense. We often feel silly to do things which don't make sense because no one is talking about them. And this is the hard thing for many people to do, and it was hard for me. But I was able to let go. When I followed my body's guidance, moving where my body led me to move, breathing through it, I was able to let go of the deep tension I had. And because I was doing it more often, more regularly, it was easier and easier. And my body was able to relax much faster and letting go of the tension. So even though it was compensation and my joints, my pelvis was misaligned, I was actually able, step by step, align my body, align my pelvis, align my joints into the position where the joints should be, which gave me the relief I needed, and the body could heal in the new, better position, meaning the inflammation settled, meaning the pain settled as well. Not straight away, but it did. But it was really about listening to my body, guiding my body as well. So having a little bit like a partnership between me, my soul, my brain, my logic, and my body. And really letting go, being able to slow down, breathe, regulate, not thinking this make sense, or not thinking about anything logically. But the shift was in aligning my body where it's supposed to be, which took the strain, the load, because through the injuries, my body's got really badly misaligned and it's still not perfect. There's still things to be done. So people often don't realize that this is ongoing work. If there were injuries and layers of compensation and the body adapted in every part, meaning more likely every joint is a little bit misaligned and so on. And because our body wants to go back, revert, it is actually ongoing work. But it's beautiful work because you are in charge of your own body and you know how to work with your body. So whatever comes in life, you know you can deal with it. You know you can do something. You are not in mercy of the basically medicine and healthcare system, which unfortunately is not always as helpful as we wish to be. But again, it comes down to your self-trust and ownership of your own body, of your own life as well, how you want to feel.
I love that because it's so simple. Just being with your body and understanding it. And thank you for that beautiful explanation, because we do hold tension in our bodies, whether it's trauma, whether it's emotion, there's always tension there. And it's about understanding the patterns, as you've rightly said, of what we hold and where we hold it. And we're always going to do that until we become conscious of what we're doing and learn to undo that. And then that's just a process in and of itself as well. So listening to our body and asking it, what is it you want? What can I give you? And just relaxing, but surrendering as well. Stop trying to control our bodies, because we do. We try and take control. I'm going to do this and I'm going to do that. And actually, when we stop and come back, and it's about mindfulness as well, isn't it? Being in that moment to be able to be with our body, and just take that time. So thank you for all of that. If I was to ask you if there was a message in all of that pain that you went through, that your body was holding on to, what would that message be?
I think for me, really, the message would be slow down. 100%, because I am the kind of person who keeps going, keeps pushing. I'm a doer, I know it. But I realize that the importance of slowing down and just be, because that's where the healing can really kick in. And now, from what I know, from what I studied, everything is based on it. We think it's some sort of science and some sort of really you have to study for years and this and that. Well, in the basis of everything, what I studied in terms of helping people to stop these pain cycles and recover actually from chronic joint or back pain, the basis is nervous system regulation, slow down, to be able to be aware of yourself, of your body, of your patterns, because no one else can do it for you. Even if you go to practitioner, even if you go to doctor or specialist, no matter who it is, they cannot feel what you feel. They can take the textbook and this is what's supposed to happen. But at the end of the day, we are so different. And I always explain to my clients, I can guide you. I can see things because I went through it. I have the knowledge now. I have now our tools, which I can give you and I can teach you. But at the end of the day, it's your body self-awareness. So we are working in partnership, all of us. So it's me, you, and your body. It's like there are three of us. It's not separate. There are three of us, and we need to really work with three of us. You need to understand yourself. I need to understand your body. So there's lots of things happening, but we can only do it when we slow down and listen.
And that in and of itself, the slowing down actually helps to regulate our nervous system as well. Yeah. And a lot of people don't realize that. And it took me a long time to realize that too, because I'm a goer and a doer. And actually it's like, no, take a step back, take a breath. There's no rush. There's no rush for anything. But we make our lives around rushing and doing more rather than just being more.
Yes.
So thank you for all of that, Bonnie. If you could share one tip today for somebody who's struggling with pain, what would that be?
We talked about it. We touched base on all of it. So the first thing is, okay, you are in a pain cycle. You probably had flare-ups before. Asking the right questions. And we don't ask the right questions, I think. I didn't ask the right questions. I wanted to have the solution. Just give me a solution for the symptoms and I'll be okay. This is what I thought. So asking the right question, but asking the right questions yourself, your body, to recognize the patterns, because it is a pattern. The flare-up was there before. What happened in your life around it? We are not talking now, we are talking, let's say, what happened last month or 2 months before you got the flare-up. What happened in your life? How did you how did you function? Was there anything you were doing for yourself, for your body? Or you were just busy? So this is the first step. The second step, when we recognize this, we can write it down, we can journal. It doesn't really matter how we get there. We can talk, actually, which is really, really helpful. Because I would never talk to myself like loud. But actually recording, now we have all these AI gadgets and everything, we can record what we feel. And I think this is very useful because we voice it. And then it will be really getting your breath on board. And I have really good practice, which I always teach my clients as the first thing. There is a science behind it, but you don't need to know the science. It's breathing where we inhale through the nose. We call it silent in-breath. So it's not like getting full breath that everything is moving, expanding. So breathing in your rib cage, in your thoracic spine, because it's the largest part of the body, the rib cage area. When we inhale into the side of your rib cage with the nose, feeling the back of the body expanding. Because when we are tense, we get really tense in our torso, especially in the ribcage area, in the thoracic spine. And that creates tension in the top of the chest, in the neck. And it's not giving good signals to our brain. Because once the neck tenses, once the upper body is in tension, well, the brain actually gets signal you are in a fight and flight. You cannot let go. You cannot really start the healing process. So you inhale with your nose, you exhale through open mouth, you relax your jaw joints as if you are fogging mirror. You close your lips, you let the air go for about 5 seconds, and you check that the tongue is resting on the roof of the mouth. Very important. You pause for a second or two, or as much as comfortable for you. And that's your one breath cycle. You can do this in different positions, sitting, standing, lying down, before you go to sleep. This will regulate your nervous system itself, but also it will expand, if you do it well, thinking about your ribcage as a balloon, but not a huge balloon. It will help to expand the areas where we hold tension. And that frees up actually the space. It creates expansion, frees up the space in your body, in your torso, in your diaphragm, in your abdominal wall, in your shoulders, around the shoulder blades, everywhere where we feel the tension. When we expand, when we free up something, then actually we may realize that we are getting less flare-ups, not as intense. If you do this every single day, I guarantee you, if you do it well, that the flare-ups are going to decrease, the intensity will be much less, and even the time will decrease. Just simple practice of breathing in your ribcage, but doing it in a way where you don't create tension in the neck and chest area.
That's lovely, thank you. And it's so simple that anybody will be able to do it to their own ability, to the degree that they're able to do it. So thank you so much for that. And where can people find you, Bonnie?
So they can find me on social media. I'm on Facebook, LinkedIn mainly, and on my website, which is my full name, as you mentioned, bonnieryckova.com. And yes, I would love to connect with you. And if anyone has any question for me, if you struggle, if you didn't find the right solution, feel free to connect with me on social media, on my website as well. There is a link to book consultation. We simply can have a chat, and I'll be able to point you out into certain directions which you can explore.
Fabulous. And I'll put all that in the show notes as well. Thank you so much for sharing your own healing on Mind Body Medicine for Self-Healers.
Thank you so much for having me, and it was my pleasure. Thank you.
Thank you for listening. Please share this podcast with anyone who you think will benefit. And can you leave me a review wherever you've listened to it to help me reach more people? Thank you.